Hello, I'm Randy Ruda, Chief Executive Officer for the National Health Council, and it is my pleasure to welcome you to this introductory video on the National Health Council's blueprint for developing patient-centered core impact sets. Made up of nearly 150 national health-related organizations and businesses, the National Health Council's core membership includes the nation's leading patient organizations. Other members include health-related associations and nonprofit organizations, including the provider, research, and family caregiver communities, as well as businesses representing biopharma, devices, diagnostic, generic, and payer organizations. This initiative is very important to the National Health Council and its membership, and it's been in the making for 2 years. We believe that the patient-centered core impact set initiative will be instrumental in building a more patient-centered health ecosystem. The blueprint, which you will learn about today, has been co-developed by National Health Council members and invited experts. And now we're seeking your input and ideas to make the blueprint as useful as possible. Watching this video and learning about patient-centered core impact sets and the blueprint is your first step in joining us on this journey. You'll be guided through the blueprint document and invited to submit comments during a 30-day comment period starting August 1st. The National Health Council will also host a strategic dialogue about the blueprint on August 17th, and I would encourage you to definitely participate. But before we begin to discuss the content, I'm pleased to recognize the sponsors of this very worthwhile initiative. They are the EveryLife Foundation for Rare Diseases, Innovation and Value Initiatives, Amgen, Edward Leff Sciences, Johnson & Johnson, Merck, Novartis, Pharma, Takeda, and the Research Consortium for Healthcare Value Assessment. It is my hope that you are as enthusiastic about the patient-centered core impact set initiative as I am, and that you will contribute your thoughts and ideas. Thank you for taking time to learn about the blueprint and to participate in this very worthwhile journey. Now it's my pleasure to transition the program to my esteemed colleague, Dr. Omar Escontrias, the National Health Council's Vice President for Research and Programs. Omar?
Thank you, Randy. As mentioned, I am the National Health Council's Vice President for Research, Education, and Programs, and I am excited to lead this department to advance our patient engagement and centricity research and ensure the voice of diverse patients are heard and their needs are met. At this point in our healthcare ecosystem, we are well positioned to address various challenges regarding health conditions and treatments impacting our patients, their families, and caregivers. A patient-centered core impact set is a valuable solution to prioritizing a list of impacts, both short and long-term, that are vital to improving health outcomes. I'm going to take a few minutes to review our objectives for this video, provide an outline of the topics to be covered, and introduce the speakers that will guide you through the conversation and we'll hear today. Upon completion of this video, you will be able to, 1, define what a patient-centered core impact set, or PC-CIS, and describe why they are important. 2, describe the steps in the blueprint for developing a PC-CIS. And 3, outline the valuable role you have in this process, especially to provide comments during the 30-day public comment period, which will begin on August 1st, and also provide feedback during the strategic dialogue meeting on August 17th. Now you will be walked through the blueprint by 2 speakers, Dr. Eleanor Perfetto and Ms. Suze Schrant. Dr. Perfetto is a professor at the University of Maryland School of Pharmacy in Baltimore, Maryland, and she is the former Executive Vice President of Strategic Initiatives at the National Health Council. Suze Schrant is the founder and CEO of patient engagement solutions generator called Expect, and formerly served as Deputy Director of Patient Engagement for PCORI and as Director of Patient Engagement for the Arthritis Foundation. Eleanor and Suze have been helping the National Health Council to lead this outstanding effort, PC-CIS Blueprint Initiative. Thank you for taking the time to learn more about the National Health Council's Patient-Centered Core Impact Sets Blueprint Initiative, and we look forward to hearing your thoughts and feedback after viewing the Blueprint overview. It is my pleasure to hand things over to Dr. Eleanor Perfetto and Sue Schrant.
Welcome to this overview of the blueprint for developing patient-centered core impact sets, which we will refer to as PC-CIS throughout this video. Susan and I will now get into more detail on what is in the blueprint itself.
What is the PC-CIS blueprint? It's a step-by-step guide for patient organizations, researchers, and other healthcare stakeholders to create PC-CIS. It includes multiple resources and examples for users to plan for, create, and assemble a PC-CIS. These 7 sections comprise the blueprint. They include the background and overview, planning, gathering impact data from patients, prioritization by patients, gathering impact data from others, prioritization by patients and others, and assembling a PC-CIS. As we review each section with you, we will use these icons and labels in the upper right-hand corner to help guide you through the blueprint.
We are essentially providing you with a very high-level overview of the blueprint through this video. It will help you dive into the blueprint document on your own so that you will be prepared to submit comments and participate in the August 1st dialogue meeting. This first section is the background section and overview, which orients you to the guiding principles for using the blueprint to create a PC-CIS. It also introduces a use case, which is linked into multiple areas of the blueprint. The use case is not an example of a PC-CIS because those do not yet exist, but it is an example of a similar project undertaken by the Arthritis Foundation that can help make some of the steps and concepts described in the blueprint more tangible. This background section is intended to get you ready to dive in and begin using the blueprint.
Another important part of the background is definitions, to be sure everyone's on the same page as we discuss PC-CIS and the blueprint. You might ask, what is a PC-CIS?
A patient-centered core impact set is a patient-derived and patient-prioritized list of the most important impacts a disease and/or its treatments have on a patient's health and daily life, and that of their family and caregivers. Let's unpack that a bit.
While the word impacts can mean many different things, for the purpose of the blueprint and PC-CIS, impacts are the many things patients tell us are important about the way a disease and/or its treatment affects their health and lives. The list or core set of impacts includes only those impacts that are most important to patients, families, and caregivers.
A PC-CIS is disease or population specific, so we expect for the blueprint to be used to create many PC-CIS in the future. This diagram presents a high-level overview of the overall process for that development. The purpose of the blueprint document is to drill down into the details on how to get the work done. Let's start with this higher level bird's eye view before getting into those details. We're going to move from left to right as we talk about this diagram. Starting in the upper left-hand corner, we have depicted the wide range of possible impacts a disease or treatment can have on a patient's health and/or life. By gathering patient experience data, we identify what those impacts are. Then, moving a little to the right, you see a funnel. Here, we ask patients to prioritize the impacts that they have reported to tell us which of those impacts are most important to them. Moving further to the right, you see a larger box where the impacts reported by patients as most important to them are combined with the impacts we learn about from other healthcare stakeholders and what we glean from the literature. In the second funnel, all impacts from patients or other stakeholders and other sources are prioritized to identify what the core set is. Please note here in the second prioritization funnel, the impacts patients prioritized are kept in the core set. More can be added, but the patient voice stays intact. It cannot be outvoted. The far right side of the figure lists some of the important downstream uses for a PC-CIS. These uses, such as informing clinical trial endpoint selection or selecting value elements in patient-centered value assessment, are among the many important roles a PC-CIS can have. We will use this figure as a reference throughout the blueprint discussion. you will see us refer to the various components in the blueprint itself.
So why are PC-CIS important? They're important for several reasons. The first is that a PC-CIS begins with patients. This is different from other efforts to create core sets. Usually those things begin with reviewing past research and published literature. And while looking at past work can be informative, some caution must be taken. That past work may not have included patients or might have not placed emphasis on the patient voice. Patient engagement is required to learn from patients those impacts that are most important to them. Past efforts have not always done this or not always done it well. PC-CIS are also important because they focus on all impacts important to patients, not just the clinical outcomes that have traditionally been studied. Past efforts have paid particular attention to more traditional clinical outcomes. Some have addressed other impacts such as social, financial, or caregiver stresses, but have not done so in a consistent or standardized way. A PC-CIS emphasizes all impacts. One example of a resource provided as part of the background section of the blueprint is a checklist designed to help you step through the process for creating the PC-CIS from beginning to end. This is just a snapshot of the first section, filled out as though a blueprint user would fill it out, noting what steps are complete, what steps are in progress, and the checklist covers each phase of PC-CIS development from beginning to end. And with the checklist in hand, you'll be ready to begin reviewing the planning section. This portion of the blueprint offers guidance and resources for all of the important considerations for embarking upon the creation of a PC-CIS.
Most important is the need to ensure patient leadership of the project team, as well as involvement of other key stakeholders. Additional considerations include assessing financial and budget needs, training and onboarding for all team members, and critically, the need to be open and transparent throughout the PC-CIS process, a practice important to adopt at the earliest stage of PC-CIS development.
After planning, we move into the very first data gathering step. A very important aspect of creating a PC-CIS is to try to avoid duplicating work. Depending on the disease you're focused on or the community of patients you're working with, data on impacts reported by patients may have already been collected, and you can evaluate that data to consider using it in your PC-CIS process. This can make your efforts more efficient and less costly. The blueprint suggests sources of data that you might consider. However, it's important you feel comfortable the existing data came directly from patients and was collected and analyzed in a transparent way.
To help you assess the data that has already been collected, the blueprint includes a tool called simply, "Is it good enough?" It includes evaluation questions you can use to assess how the data were collected. It helps you assess the quality and relevance of the compiled data to help you decide if you want to consider using it in your PC-CIS effort. You can see an image of the full guide in the background of this slide, and we've zoomed in on just one section to show as an example. In this case, the section is transparency. So assessing how transparent the process was for the data collection, and can you even assess the methodology to determine patient centricity? This form helps you think through these things.
If you cannot locate existing data, you may need to collect data from patients yourself. Embarking upon primary data collection is a big step. The blueprint provides tools and examples for how this can be accomplished, including the typical rules and regulations that cover this type of data collection and the types of expertise that will be important to have on your team. A hallmark of the PC-CIS creation process is that not only is patient data on impacts gathered first before other stakeholder data, but that the first round of prioritization focuses only on patients prioritizing the impacts most important to them. Here again, this step can be cumbersome, but the blueprint provides a long list of resources, references, and examples to draw from.
The next step is gathering impact data from others. Just as in the first round of data gathering, this step should also begin with an assessment of what might already exist. This is the opportunity to bring in existing research and literature that may be relevant to PC-CIS, drawing from perspectives of other important healthcare stakeholders. Again, if existing data cannot be located, some primary data collection might be needed. This step of PC-CIS development is very similar to what we talked about a moment ago when gathering data directly from patients. And in fact, you'll see the same examples of methods listed in this section of the blueprint as were listed previously. A key difference is that the first round of data collection was focused specifically on collecting impacts from patients, while this round draws from other healthcare stakeholders. The same collection of tools and resources is available in the blueprint to help guide you through the process.
Here again, we have a prioritization stage, only this time we're prioritizing patient and stakeholder information together. Similar methodology is used in this round of prioritization, as was used for the patient-only round of prioritization, with one important caveat. It's critically important during this phase that impacts prioritized as important by patients cannot be removed or downgraded. In addition to the tools and resources the blueprint includes to help with prioritization in general, it also provides specific examples and guidance for ensuring critical patient-reported impacts are not lost during this step.
The final step in PC-CIS creation is assembling the actual set of core impacts, along with a robust description of the process used and how the data were systematically narrowed to the final set of impacts. Another tool provided in the blueprint, the PC-CIS reporting tool, will guide you step by step through considerations on how to fully and clearly describe the PC-CIS and the process used to create it. Here we have penciled in numbers as an example, just to demonstrate how you might report these numbers. But please keep in mind, we do not believe or advise that there is a right number of impacts. In this example, the final core set includes 11 impacts.
So we've gone through many of these items, but when you review the blueprint, you will see there are many, many more tools and resources embedded throughout, including in the supplemental materials at the end and the glossary at the very end of the document. These resources are intended as a quick reference to provide guidance and options as you chart a course for PC-CIS development.
Thank you for taking the time to view this video and learn a bit more about the blueprint and PC-CIS. We want to ask each of you to take some additional time to go to the URL listed here. Please review the blueprint and the documents located there. Also, you will have access to a comment form and instructions on how to submit your comments. Submit your completed comment form to nhcprograms@nhcouncil.org.
In addition, we encourage you to register for the August 17th dialogue meeting, where patients and other healthcare stakeholders will discuss the new concept of PC-CIS, its strengths and challenges, and the strengths and challenges of using the blueprint.
We understand that after viewing this video and reading through the blueprint and supporting resources, you may have questions. Please join us for a live virtual question and answer session on any of these 3 dates to have an opportunity to have your questions answered and to hear what other participants are asking.
We want to thank you once again for taking the time to be part of the co-development of the PC-CIS blueprint. You have an important role and we need your input into this process. We encourage you to submit comments and to be a part of the dialogue meeting on August 17th. We appreciate your participation.